Hello, I'm Lauren Haldeman, Editor-in-Chief of the Journal of Nutrition Education and Behavior, where we are advancing research, practice, and policy. And each month, we select an article to feature as a press release with an accompanying podcast. Today's podcast article can be read in full at www.jneb.org for free for the next 3 months. Today I'm speaking with Ms. Saira Sarwar, who is the corresponding author for the article titled Associations Between Adolescent Food Environments and Dietary Intake. I'm really glad to have you with us today, Saira.
Thank you so much for having me. I'm really excited to be here.
Sure. And can you tell us a little bit about yourself?
Yes, so my name is Saira. I am a clinical psychology doctoral student at the University of Nebraska-Lincoln. At UNL, I am a part of the Pediatric Health Lab headed by Dr. Timothy Nelson. And our lab focuses on kind of investigating the factors that influence high impact pediatric health behaviors like diet and physical activity.
Great, thank you. And can you give us a brief overview of the paper?
Yes, so I'll start with our methodology. So we utilized a sample of about 204 adolescents and their caregivers, ranging in age from 14 to 17. We actually oversampled for socioeconomic risks, so about 40% of our families received public assistance or were below the federal poverty line at the time of the assessment. In terms of kind of the in terms of data collection, we invited adolescents and their caregivers to come into the lab where adolescents completed 2 measures of dietary intake. So they completed a 24-hour recall measure that kind of looked at all of the food and beverages that they had consumed over the past 24 hours. They also completed a measure of kind of over the past week, how much dietary intake and beverage intake they had consumed as well. So that was a validated questionnaire. In terms of the home food environment, we had caregivers complete a validated questionnaire measuring aspects of the home food environment. So things like fruit and vegetable availability, as well as fat and sweet availability. And then to kind of assess the neighborhood food environment. So this was kind of a multi-step process. First, we compiled a list of all of the food retailers within the study area, so within the Lincoln, Nebraska area. Then we trained research assistants to kind of ground truth this data by conducting systematic audits of all of the food retailers that we identified. And then they used a validated questionnaire called the NEMS questionnaire to kind of classify the food retailers based on type. So once we had all of the food retailers validated, we then created kind of adolescent-specific buffers around each adolescent's home address. And this represented their neighborhood food environment. And it kind of included things like number of fast food joints, number of convenience stores, and things like that. So I think one of the things that was really novel about our study is that each adolescent had kind of a specific neighborhood food environment, and we were able to utilize primary data on the neighborhood food environment. So again, those in-person audits, I think, were really crucial to kind of validate it and make sure our neighborhood food environment was kind of high quality. Moving on to the results. So we found kind of a few different novel findings. So one thing that we saw was that home fruit and vegetable availability actually predicted greater adolescent diet quality, so greater HEI score, as well as greater intake of fruits and vegetables. So that's kind of what we would expect. Interestingly, home fruit and vegetable availability also predicted less intake of fast food. So you can kind of see that it appeared to be related to greater healthful food consumption, as well as less consumption of less healthful foods. In addition to that, we saw that home availability of fats and sweets was associated with greater intake of snack food and kind of sugary beverages. So we kind of saw that link in the direction that we would expect. In terms of the neighborhood food environment, we saw less associations between the neighborhood food environment and adolescent diet. We did see that greater fast food counts within the adolescent's food environment around their house uniquely predicted greater sugary beverage intake. So that was in the direction that we would expect. That was kind of in line with our hypotheses. However, one finding that was kind of unexpected was we saw that greater convenience store counts around the adolescent's home actually predicted greater healthful food consumption. So that was not what we expected. We expected that convenience store counts would be related to greater kind of greater intake of the less healthful foods. So that kind of indicated to us that maybe like this broad characterization of food retailers as either healthy or unhealthy might be kind of an overly simplistic characterization. And there is some data that convenience stores may offer kind of easily accessible healthy food options. And maybe that was part of the reason why we saw this association between convenience stores and healthful food.
Thanks very much, Saira. That is interesting, as I think you're right. We oftentimes equate convenience stores with unhealthier items. This will be an interesting next step in this research, maybe. So tell me a little bit about why this research study was important.
Yeah, so we know that adolescents have lower quality diets than other age groups, and we also know that dietary behaviors are, significantly contribute to risk for kind of multiple leading health concerns like cancer, heart disease, and obesity. Kind of in recent years as well, there's been more recognition of the role that kind of systems level factors play in possibly influencing adolescent dietary intake. However, a lot of the studies in this area don't kind of utilize suboptimal methods for assessing things like diet and neighborhood food environment. So what we wanted to do and the contribution that we hope that our study makes is to use high quality, well-validated methods like 24-hour recalls, GIS methods, as well as primary data to measure the neighborhood food environment, just so that the methodology in our study is, makes a contribution and is well validated so that we can be confident in kind of our results.
Sure, that's a really important point, the use of validated tools, and we need more validated tools to help in the important work that we do in nutrition education. Can you talk a
Yes.
little bit about what implications these findings have on policy and intervention?
Yes, so our findings suggest that interventions that target the home food environment, and actually in particular fruit and vegetable availability, may be particularly impactful in order to help improve adolescent dietary intake. So if you kind of recall from the discussion of the results, the adolescent fruit and vegetable availability in the home was associated with, again, greater consumption of healthful foods, as well as less consumption of less healthful food options. So it seems like fruit and vegetable availability, kind of will give you the most bang for your buck, so to speak, in terms of improving adolescent diet quality. And also kind of on an individual level, I really hope this study empowers families of adolescents to kind of really harness their home food environment as a powerful tool to positively influence adolescent health.
Thank you very much. If you had to pinpoint the most important takeaway from this study, what would it be?
Yeah, I think it would really highlight again, like the home fruit and vegetable availability. I think out of all of the food environment variables in our study, that was the one that we saw having the most association with the adolescent diet in healthful directions. So I would really emphasize to families try to focus on that fruit and vegetable availability because it seems to be related to greater impact intake of healthful foods and also less intake of less healthful foods.
Well, I agree. That's a very important takeaway. Thanks so much, Saira, for spending this time with me. Is there anything else you'd like to mention?
Yes, so I would like to thank all of my co-authors on this paper. So Dr. Timothy Nelson, Dr. Jenny Hill, Dr. Amy LaRoche, Dr. Jennifer Nelson, Dr. Kimberly Andrews Espy. I would also like to express my heartfelt appreciation to all of the pediatric lab research assistants and lab staff. And then last but certainly not least, I want to thank all of the adolescents and their families that participated in this study and helped us further our understanding of adolescent dietary behaviors.
Wonderful. Thanks so much again. And to all of our listeners, remember you can read this article in full at www.jneb.org for free for the next 3 months.